Be performing a Deuk laser disc repair on a patient who's got back pain and degenerative disc disease. Now, we're going to be going in on the left side at L2-3, shot, L3-4. Luis, everything okay?
Yes, just thinking.
We're on the left side here. It's 2-3 and 3-4. You agree?
I agree.
Shot? All right. Shot? I'm getting deflected by some bone. Shot? Yeah, that's better. Are you comfy? Shot?
How you doing, sir? He said he's okay.
All right. Shot? Let's go with an AP and just see where we are. So we should be entering the foramen at L2-3 on the left side. It's interesting, he's got very difficult to see bones. Some of it's going to be penetration, but the other is potentially, yeah. Huh, all right, so we're more lateral than we need to be. Far more lateral. How is our blood pressure? All right, well, let's hope that this spine is more posterior. Shot? That would be nice. Shot? That should be the facet. Shot. Let's get another AP. Just give me a quick AP. That's better. Lateral. So people ask me all the time, can you do endoscopic Deuk laser disc repair on degenerative disc disease? And, you know, the answer is yes. That's exactly what we're doing here. This patient has degenerative disc disease. Shot. And my intention is to fix this problem without having to do open surgery. That's what he wants. You're doing great. Just hang in there. Shot. Uh-huh. Shot. 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 You all right? Shot.
He said yes.
Shot. When I say shot, folks, what I'm saying is shot from my technician, Jordan, to give me a picture. To take a picture, basically. Shot. 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 Where do you feel it? 5, 4, 3, 2.
Where are you feeling it, Dan? Back or leg?
Should be in his back. I'm not moving my hand either because every time I move it, soft tissues push it out. AP.
Where are you feeling it?
Coker.
Back or leg?
Poker from there, please. Poker.
No?
Yep. Thank you. Quick. Thank you.
Perfect. Lateral. So this is 2-3 on the left. Everyone agree that's the right level?
Yes, sir. Yes, sir.
Alright. That looks pretty good. Shot? That's crazy, huh? I don't know how we got in there. Give me an AP. I just got to see this. No, it's tiny. That's what I'm saying. I'm very happy we got in. I just got to confirm it. Quick shot, just quick shot. Don't set up. It takes too long. That's it. We're in. All right. Happy about that. That's a tough one because it's really bone on bone and totally collapsed disc space. So people say, how can you fix that with laser surgery? The laser is a very powerful tool. Very powerful. All right, show me 3-4, please. It's not terrible, but you might be able to do a little better. Shot. Nice. Shot. Thank you, Luis. Shot. I hit in the facet. Look at how arthritic that facet joint is. Shot. There we go. Shot. You awake?
How you doing, Daniel? He said, yes, sir.
Shot. AP. So I'm rubbing up against that superior facet of L4. All right, back to a lateral, please. Just about there. Patient's doing really well, right? From an anesthesia standpoint?
Very well.
Yep, shot. All right. I can just get around this corner. Shot. Could be just bone spur, that's all. Just a lot of bone spur there. Shot. Shot. That's right where the spurs are. That's for sure. You okay?
You feeling that in your back or leg? Back.
Mm-hmm. Yeah, you're doing great. Just lay still. Gonna be done before you know it. Shot. Really close. I think we may be close enough. Shot. All right, I think we're close enough. Huh? Head down? Yeah, head down. And then the right side is 4-5, correct? Let's come south just a little bit. Shot. 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 AP. Look at how much arthritis is on that right side, right by the needle. All the black color is bone that's very thick from years and years and years of arthritis. All right. Shot. Shot. You okay? Huh?
Yes or no, you okay?
Where do you feel it?
Where are you feeling your pain, back or leg?
Sit back.
Take a shot. AP?
You able to do this one?
That good enough for you? Of a discogram?
Need some good music in there for that.
Bum, bum, ba-dum, bum. I'm always ready for some disco. Huh? Shot? Damn. Luis has got to be my lucky charm.
Use primary irrigation.
All right, well,
And
are
then
you
some,
awake?
lights, please.
Are you awake?
Say yeah.
Are you not happy you're awake? Would you rather be sleeping?
Thank you.
Do you know what's next?
He did not watch the video.
Hmm. How much of your problem is back pain versus leg pain?
50-50 or is it
All back.
75, he said.
All right. Are you comfortable? How bad is that on a scale of 1 to 10?
What'd you say? About an 8? 8.
Is that where you get your back pain typically? Huh? Yeah. 8 over 10. Concordant. 4 or 5. All right, so we just tested one disc. I don't think we're in on that one. We're not in on that one. Here, let me have the... Where's the next? He took a lot on that. You okay? How bad is that on a scale of 1 to 10?
9.
Is that where you get your back pain? All right, 9 over 10 concordant at 2-3. I don't think so. I'm so close yet. I don't think so. Yeah. All right, we get to put you to sleep. When you wake up, we'll be done, sir. Go ahead and count from 1 to 100. So we've got the needle in great position inside the disc up here at 2-3, and again here at 4-5. But I'm right at the edge of the disc at 3-4. I'm not going to do a discogram because it's just going to squirt the dye outside the disc. We want it inside the disc, not outside. Anyway, the discograms were very telling. He had 9 out of 10 pain and 8 out of 10 pain. And I think he's going to do really well with the procedure. So the nice thing is his spine is actually really far back. He's a big guy, but you think, okay, well, his spine could be really far forward, like with a lot of soft tissue in the back there. But his spine is actually pretty posterior. Shot. And as a result of that shot, it wasn't as difficult as it could have been to get to the disc. Now the last patient, he had a more anterior spine, and it was anterior means towards the belly button, away from me, and it was a lot harder to do. Why don't you show our audience what why people get back pain from a herniated or degenerated disc. We have a video that shows why.
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
I think we're okay. I think the tube is right near at the beginning, right, of the disc?
You want to push it more?
Maybe a little bit, yeah. All right, welcome back. We were just chatting about how a lot of people can't comprehend that we're able to fix these people's back pain even when their disc is collapsed. You can take it out. And they think everyone's told by doctors that it's bone on bone that causes back pain, but it's not. It's actually the annular tear, the same thing that causes back pain with a regular disc herniation. It's no different. And that's why we're able to cure it, whether degenerated disc versus herniated versus a bulging. It's all the same. The cause is the same. Oscar, you doing a good job today? I'm telling you, you're doing a good job. You're doing a good job, yeah.
Can I have
I'm happy with your progress. All right, let's see what we got here. A lot of blue. Grab her.
Yes, sir.
So we're inside the L2-3 disc.
This one, yeah, but I need her.
This is, there's a herniation right there. See how easy that was? Right there for the picking. Today is my son's graduation.
Congratulations.
Well, it's a graduation celebration for the school.
What time does it start?
10 minutes?
I need a blue towel here.
No, it's, you know, I realize that my first commitment is always to my patients. So I'm probably going to miss it, but he is graduating high school and
To the back.
going on to Princeton.
That's the reason of that. Like going to the back.
But I got to tell you, he has become the slacker of all slackers. I thought I was a slacker back in. Did I tell you? I never told you about my. It's embarrassing. Medical school, USC, Los Angeles. Medical school is 4 years. I should never admit this. My wife would just kill me if she knew I was telling you all the truth. But I like telling the truth because, you know, some people can relate, and I'm not perfect. Anyway, med school at USC County Hospital. I knew I was going to match in neurosurgery and, you know, top of my class, valedictorian, great grades. And I chose to do in my last year anesthesia, rotation. And it just so happened to be that many of the anesthesiology residents and I were friends. We would work out in the gym together. They were cool guys, gals. Anyway, For 8 weeks, every day I was supposed to go to the hospital and go into an operating room and just kind of hang out with the anesthesia residents and watch the surgeries and learn how to do anesthesia. Maybe do a couple of intubations. But by that time, it was the end of my 4th year, and I had already matched in neurosurgery. And I was tired of working my ass off, you know, studying all the time. So I decided, with the help of my anesthesia colleagues, that I wasn't going to go and go into the operating room. So I did an entire anesthesia. Oh, look at that. Is our tube compressed? It looks oval. It looks like we smashed it. Let's just say that the residents were very generous in their appraisal of my skills as a medical student doing anesthesia.
We couldn't graduate at University of Miami without doing 6 weeks of anesthesia. It was a core rotation.
It is a core rotation. I had to do it. Yeah. I had to do it. Anyway, you know, I'm only saying my son has kind of figured out, he got into Princeton. He's enjoying his last few months of being a senior. The furthest thing on his mind is sitting in class doing schoolwork. So he's, let's just say he's passing his classes, but not in such a way that Princeton would be proud. I think he's got 1 B minus, and you know, he's got a bunch of A's still, but he's doing his best, but he's learning to enjoy life as well. I can't say I blame the kid for wanting to take it easy. He's earned it, you know. What is it?
I just like got so hard my senior year of high school. So I was gonna graduate a year early, and then I was running nationals cross country. So I decided to stay just run cross country.
Yeah.
But then I broke my foot while I was warming up for nationals out in Virginia.
Oh my.
So I didn't even get to run my senior year, but I was already in school, so I just took a bunch of art classes. I did AutoCAD.
See, you took it easy.
Yeah.
Yeah. I did it too. I think we've all done that. I mean, I would, maybe not Dr. Berndes. Have you, Dr. Berndes? No? You busted your butt the whole time? Shut up. Trying to make us feel bad? You made your son what? Really? I let up on the gas. And honestly, I don't regret it. I'm never going to be an anesthesiologist in my career. That was the only one I slacked on. But I got to tell you, I had some great reviews.
I slacked off at dermatology.
Aha! The truth. Dermatology. Yeah, the dermatology is kind of a slack off rotation anyway. There's no dermatology emergencies except maybe, you know, Stevens Johnson. What? That's not derm. That's trauma or plastics. Yeah. I did burns. I hated it. Dude, I did burns in, where was it? UC San Diego. Yeah, we had about a 10, but the point is man, those injuries are bad. I can't deal with it. Dude, forget about that. I'm just talking about the skin. Just looking at that skin and the grafting and everything. You're okay? Oh yeah. That almost turned me off to medicine completely. You know, burns. It's some reason they don't. It doesn't bother certain people, but it bothered me a lot. All right, we're pretty much done with this disc. You like burn patients? Just because they don't talk and move.
Yeah. No, I don't know. I like complicated patients. And I work in trauma, so I get
All right, well, I guess I just admitted I was a slacker for my anesthesia rotation.
Drop off, please. Drive on, please. Thank you.
I'm sorry, but it was 6 or 8 weeks. You know, I've never intubated anyone. I've never intubated a patient.
During that whole 6 weeks, you must have never got to the OR.
You think I was joking? You think I was joking? I wasn't in a movie theater. I was in the gym and I was enjoying life. I would go to the beach and hang with my med school friends, you know. I was the most isolated person in medical school, like 5 of us. We never stopped studying. Literally never went out for 3.5 years. So to have a little break at the end was kind of nice, you know, to feel like a human being. You have no idea how much I studied.
How many are in your class?
This is that one we're going to have to bang in. 175 students in my med school class. How many? We lost 10%. Becca? 10% failed. I think 10 or 20. Huh? That was a failure rate. I think it was around 12 by the time all was said and done. Shot? Careful, careful. Shot? Shot? I still remember the first day of med school when the dean came and said, because we had a bunch of gunners, you know, these are the most gunning people in college that go into med school. Shot? They're so competitive. They're used to, you know, people who go to med school are top of the class and always studying and always trying to outdo the rest of the classmates. So I remember the dean came and said, we don't rank students. We don't rank you. They lied. Of course they rank us. But they didn't want people doing crazy stuff. Like, all right, like for example, yeah, you go to cadaver lab, right? And then they would cut the arm off the cadaver and hide it so that the other students couldn't study. You know, couldn't learn. And then the test would come and you'd fail because there was no arm to study. That's the kind of stuff they would do. Or they would put the tags. Oh, come on. It's cutthroat. Sean? I'm not saying it's okay. I'm saying that's what people would do. Not me. But the point is they had to lie to everybody and say we don't rank you, because if they told them the truth that they rank us, that's exactly what they do. They take the body part home and hide it. I'm not kidding you. No, I'm not kidding you. That happened. It actually happened.
It's so disrespectful to the dad, to the class, to the teachers.
That's like desecration of
What a horrible, that's offensive.
Dude, that's nothing. Oh my God, the head of anatomy came in and some of the students they had pizza They had beer, pizza, beer. They were studying, and they were playing football in the gross anatomy lab, except there was no football. Oh yeah. And guess who was walking through? 3 potential donors. They walked in on that. Yeah, it was a big to-do. The dean got so pissed. They had a talk with all the med students. They told them what happened. I wasn't part of it. I mean, I didn't even know they were doing that.
How
But
were the potential donors still ambulating? Oh.
the potential donors are obviously people who want to donate their body to science. So the school is like trying to get them convinced you ought to donate your body. Here's what happened so the med students can learn. And here they walk in and they got pizza, beer, they're playing music, rock and roll. And there's a what? Spleen, yeah, a heart. There's a heart being, hiked. They're doing a down and out, a button hook for a heart.
Funny but not funny.
I'm telling you though, if the students at USC knew they were ranked, they would literally sabotage everything. Huh? We had very, very competitive students. What? Who are you talking about? Oh yeah.
Lights off, please. Thank you.
You know, yeah. I gotta say though that I think it was the right thing to do, to lie, tell the students we don't get ranked, but it probably made everything a lot more civil. It's kind of a white lie, because they have to rank for AOA, Alpha, Omega, Alpha. That's the only way you get into AOA, the Honor Society, is through class ranking. Anyway. No. At USC, the top 5 became the top 5. Became junior AOA, and we chose senior AOA, the other members. So the top 5 get in automatically, and then they select from the top 20% who else they want to join, up to, I think it was like up to 5% of the class. 5%. It was around 10%. Top 10%. So the top 20 were included for eligibility to be picked as in the top 10%. That makes sense. It was a long time ago. You're doing great. We're almost done. All right, so you can see we're inside that disc. Not much disc material left, but the pain is coming from this spot right here. And that's what we're after with the laser. The laser is really the only way to get rid of this thing. I mean, you may be able to drill it out, but who wants to put a drill in someone's spine? Right, Luis? You do? You're like, oh yeah, yeah.
No, I say I agree.
Huh? I'm like, no, who wants to put a drill in someone's spine? Luis is like, oh yeah, oh yeah. I'm like, you do?
So my sister just bought a house, and she doesn't know, she has a ring doorbell, and she's like, I don't know Well, yeah, I've got some ortho, and I got to drill some skulls, and I've read a lot of IO, so I think I can figure out how to put in a ring to work well.
She in med school?
She's, in a work
She doesn't have a friend
surgery right now.
that can help her?
Well, he's in the process of moving from Salt Lake City, so he's in Salt Lake City.
Now wait, where are you from? Yeah, you're from,
Wisconsin, but she's in Ohio.
right, but where in Wisconsin?
In Appleton.
Oh, Appleton. What's Beloit? Where's Beloit? All right. I just remember seeing Beloit when I was traveling. You did?
Yeah.
My God, what a party town that must have been.
Well, all I did was study.
Okay, I believe
I
you.
was working, my grandmother was passing away from Alzheimer's, so I was working with her and then working full-time as well, so I didn't really party. But I did get to look at Lambeau while I was in clinical and at my first job.
You got to look at what?
Lambeau Field.
I didn't understand what that was.
Lambeau Field, that's where the Green Bay Packers
Green Bay Packers.
Oh, I'm sorry.
and Dr. Deuk.
I'm.
That's the whole.
Wisconsin is the cheeseheads, right? So did you ever put a cheese head on your head? Ah. Yeah. Oh, Beloit? Is that considered a bad area?
So when he put that, see better. You can see.
All right, so sorry about that, but the visibility is not great, but that's what we need to see right there. Sometimes you got to be a little creative. Laser? Just about done. I need another 1 minute. Huh? Yeah. Trevor? I think we're just about done right here. We're done.
You good? All right.
Scope off. Let's just go.
No? You want the count? That's it?
Mhm. Good job. Oscar, will you put pressure right here for me? All right. Careful. Mhm. Knife. Shot. Knife down. How's he doing, doctor?
Good.
Shot. The nice thing about having virtually no disc left from a operative standpoint, the only nice thing is that there's not a lot of disc herniation to remove. You know? But Everything else about the surgery is harder. Leave it. Shot. So we're going to bring this tube in. Shot. Nice work. Last disc. L4-5. Everyone in agreement? All right, any questions from our audience?
No current questions, Doc.
Wow. Let's go ahead and play the video showing what the Deuk laser disc repair does to repair these annular tears and herniations.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
We were just talking about movies, folks, so if you're just joining us after watching the animation, we were talking about Aladdin and how Jordan is looking like Aladdin right now with his outfit. Yeah, it's a shame that Will Smith did what he did because he's such a good actor, such an iconic actor, and I don't know what he was thinking. I'm sure Chris Rock deserved it, but still, you don't do that kind of thing to somebody. There's so many other ways to dress it.
I would have just said something and just sit on your seat and not come to him.
I would have dealt with it afterwards. It would have just made Chris Rock look like an idiot, you know?
I would have done it after.
Yeah. Unfortunately, now he's got
We're almost done, buddy.
horrible backlash.
Good. You're doing great.
You know what else was a good movie? You guys ever see the? I think it's Sands of Time. What was that movie? Oh, man, it's like Aladdin. Right? You know what I'm talking about? Yeah, Prince of Persia.
Oh,
Prince of Persia.
Jake Gyllenhaal.
Yes,
Yeah.
that was a great movie. You guys got to see Prince of Persia if you haven't seen it. Really good movie. You did?
This is similar one to that one, but it has a different name. I can't remember the name of it, but it was really good also. It became a video game too.
There's one something of the gods. Maybe a minute left. Yeah, push it towards me. All right. No, we'll do the usual. Yeah. All right. Okay. Good job. We are done. Scope off. Little antiseptic. Any questions you might have about the surgery? Type them up. Are we back?
Yeah, we're back.
I'll be happy to answer them, but we're going to end our live stream now. I think everybody's tired. It's been a long day. So if you've got a question, feel free to type it up, and I'll do my best to answer it for you. Oscar, you did a great job today. Luis, good job. Jordan, everybody. Crystal. Dr. Berndes. Very impressed. Thank you all for sticking it out. Sorry about the long day. We're going to work on shortening them up for a little bit until we get our mojo back. Huh?
You'll be here all June, right?
I don't know. June? Are you joking? June? Well, June. Yeah, you're right. I'm not going to be here all June. I'll be missing the last 2 weeks. So.
Are you going to, you're back to your?
I'm going to be in. So, the next race is Misano, Italy, in 2 weeks. My wife will go to that. And then Paul Howard will take him to Spa in Belgium. And then I'll take him to Zandvoort.
Zandvoort.
Yeah, in Belgium, Holland, yeah.
That's where my family's from.
That's where we're going to be racing.
That's my home.
It's a famous track. And then I'm going to take him after that to Red Bull Ring.
Where is that?
That's in Austria.
At least he gets there. Yeah. Look at your star places. Yeah.
Oh yeah, for sure. He's racing on all the Formula One trucks.
Zandvoort's a fun town.
I've never been.
It's a very, my father was born there.
Yeah?
Yeah, it's a little touristy area. It's right on the North Sea.
North Sea, really?
Water, yeah, it's beautiful.
Huh.
A lot of really nice sand dunes, a lot of history there.
I've been on the North Sea when I went to, but it was, we raced, where was that? Sweden. Sweden. Okay, if you have any questions, this is the time to ask them. Any questions?
No current questions.
All right, blood loss 3 mil. Great job, everybody. Wrap it up. You can go ahead and do a countdown and sign off.